Hi, my name is Fernando Pisco Mendoza. The topic for today is brief report, actionable diagnosis of neuroleptospirosis by next generation sequencing. What is a neuroleptospirosis? Definition. Leptospirosis in humans is a common zoonotic disease transmitted through rags and is found all over the world, more so in the developing and underdeveloped countries. It is observed in urban and rural settings, in tropical and temperate climates. Neurological manifestations seen in about 10 to 15% of cases are routine and remain unrecognized and diverse. Now a video.
Our pets are wonderful friends, and they help us in so many ways. But we need to take some smart precautions when caring for our pet friends and when visiting petting zoos. You may remember this last spring, over 20 children became ill after visiting a petting zoo in Central Florida from E. coli exposure. Good sanitation and proper regulations keep such occurrences rare. However, there is another disease that all dog owners and outdoor enthusiasts should be aware of: leptospirosis. This bacterial disease affects humans and their pet friends and causes a wide range of symptoms, including flu-like illness and even kidney damage. Leptospirosis is usually caused by exposure to water where pets or wildlife have been.
We have seen several cases of lepto in our hospital. Most of them do get better with aggressive antibiotic therapy, especially if we treat them early enough. And I can also say that all of the cases we've seen have not been vaccinated.
This bacteria enters the body through the mouth or even the skin and can cause rather serious kidney disease within a few days to a few weeks. The incidence of leptospirosis is on the rise with urban children and people who work outdoors or with animals. It's also being seen more frequently in our family dogs.
Prevention is the key, and for that we have a very effective vaccination.
Dr. Jasek recommends all dogs at risk be vaccinated for lepto at the time they get their regular booster shots. Remember, dogs age 7 years for every 1 human year, so veterinarians now recommend having your pet examined at least twice a year. Dogs do age faster than people, so waiting a full year to see your veterinarian would be like you seeing your physician every 7 years, and that's not smart. I'm Dr. Jim Humphreys reporting.
Application in medicine. In a case study published in the New England of Medicine, routine medical and laboratory testing failed to identify the cause of encephalitis in a 14-year-old patient, leaving him in a medically induced coma with few dreaming options and little hope. Identify the exact cause is critical for therapy, but may be challenging.
The leptospira bacteria can be found in fresh water that is contaminated by animal urine. The infection occurs in warmer climates. It is not spread from person to person, except in very rare cases when it is spread through breast milk or from a mother to her unborn child. Risk factors include: symptoms can take 2 to 26 days, average 10 days, to develop, and may include dry cough, fever, headache, muscle pain, nausea, vomiting, and diarrhea. Shaking trolls. Less common symptoms include abdominal pain, abnormal lung sounds, bone pain, conjunctivitis, enlarged lymph glands, enlarged spleen or liver, joint aches, muscle rigidity, muscle tenderness, skin rash, sore throat. Avoid areas of stagnant water, especially in tropical climates. If you are exposed to a high-risk area, taking doxycycline or amoxicillin may decrease your risk of developing this disease. Leptospirosis is a common disease, yet every individual needs unique treatment and care. We encourage people with leptospirosis and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about leptospirosis and how
Okay. Now a video about the pathogenesis.
For their pathogenesis, we know for any bacterial pathogenesis, there are sequential steps. Steps like adhesion of the bacteria with the host cell, then invasion, then finally the damage of the host cell and escaping their host immunity. Now, in this case, the invasiveness of this bacteria is due to adhesion. Obviously, the mechanism is provided here. This first step is the adhesion of this bacteria with the host cell. So this is the bacteria and this is the host cell. So first step is this adhesion. Bacteria will come and adhere to the host cell via kind of receptor, via kind of physical interaction. Then that will be endocytosed inside. So here we can see it will kind of get inside. So let me change the color for the bacteria. Let's say the bacteria here is red in color. Let's say the bacteria is red. So here we can see the bacteria is getting inside the cell. Now once it is getting inside the cell, let's draw the cell. Here we go. This is the cell, a host cell inside where we are having a vesicle. Inside the vesicle we are having the bacteria. Now the formation of this vesicle is called the endosome, right? Because the vesicle is formed after the endocytosis, so we call them endosome, right? The endosome is formed. Now from this region it will induce either apoptosis of the cell, apoptosis of the cell, or necrosis of the cell. So they are actually fiddling around with the signaling pathway inside the host cell, and they will modify the pathway in such a way so that it will kill the host cell, either via apoptosis or programmed cell death pathway, or via tissue necrosis. Okay. Now the route of infection in this case is simply, suppose this is the organism and it is finally coming into infected animal discharged with urine, and then it will contaminate water or soil. We have already seen all the steps. Let's see it again. Once water and soil is infected, if the human is in contact with water and soil via a kind of wound in their skin, they will get this bacteria in their bloodstream. Now after getting this bacteria in the bloodstream, it will move, and what it will cause is leptospirosis. Now the infections and disease symptoms we are going to see is called as leptospirosis, right? And from this leptospirosis condition, it is a kind of 30% fatal and 70% recoverable. So most of the time it is recovered, but sometimes it can be fatal and it can kill the individual.
Cons. The standard diagnostic assay for leptospirosis detects the host serologic response. The degree of immunosuppression resulting from SCID and rituximab therapy in the case patient make it unlikely that he will have a detectable antibody response even if the diagnosis has been considered a priori. Furthermore, his treatment with intravenous immunoglobulin may have clouded the interpretation of a positive result. Leptospira spirochetes are typically not detected by means of routine microscopy and cannot be cultured with the use of standard media. PCR-based testing is available but has limited sensitivity, given the wide diversity of Leptospira species and the lack of standardization among assays. Pros. Next generation sequencing is increasingly used in oncology for tumor profiling. In addition, it is a valuable tool for the diagnosis of various rare diseases and genetic disorders. Unbiased in next generation sequencing coupled with a rapid bioinformatic pipeline provide a clinically actionable diagnosis of a specific infectious disease from an uncommon pathogen that eluded conventional testing for months after the initial presentation. This approach does facilitate the use of targeted and efficacious antimicrobial therapy. Now another video about the next generation sequencing.
The word sequencing, next generation sequencing. It's a very cool sounding term, right? Like sounds like new wave or post rock or post punk or something like really cool, right? It's what it means to me is that basically, well, what it doesn't mean to me, it doesn't refer to technology. It doesn't refer to sequencing by ligation. It doesn't refer to semiconductor sequencing or sequencing by synthesis. Next-gen sequencing to me represents a new era where sequencing one's genome becomes commonplace. When basically, you come into the doctor, getting one's own genome sequence is as simple as ordering any other kind of test. If you come in with a sore throat, instead of sending the throat swab off to the lab for culture, you sequence the throat swab. And so you can understand your microflora. You can possibly be able to detect cancer at an early stage in samples by genome sequencing. And that becomes commonplace in medical practice. To me, that's what next-gen sequencing really means. And I think for the next generation of humans, it's actually going to be a real thing.
Issue applied in Ecuador. Reporting was initiated in 1984. The average number of report cases during 1984 to 1987 was 0 per year. Individual years: 1998, 46 suspect cases. Okay. Conclusion. Once in routine clinical use, next-generation sequencing can prove critical for diagnosing cases of encephalitis and meningitis, like the one reported here. In addition, it will be beneficial for many zoonotic and infectious diseases that are difficult to diagnose using routine testing. Sequencing-driven diagnosis may be available, especially in critical ill patients with severe infections, including sepsis. In such case, sequencing may not only identify the responsible microorganisms, but may also provide clues in drug resistance.